Nothing to disclose. So 2 weeks after spinal cord injury, 2 weeks later, PD9 inhibitor or vehicle was administered by IP injection for 2 weeks. And then 2 weeks later, cystometry and EMG were performed. And L6, DRG, and bladder urethra were removed for real-time PCR. This slide shows a single CMG result. Non-bonding contractions during bladder filling significantly reduced after PD5 inhibitor treatment compared to the vehicle-treated SCI mice. Storage and voiding dysfunction were also improved. Voiding efficiency was significantly increased with reduced post-residual urine after in PD5 inhibitor treatment SCI mice. So this slide shows the representative CMG and EMG activity tracing. The voiding occurs during the period of reduced intravesical pressure in association with reduction in EMG activity. So we measure the voiding contraction times and reduced EMG activity time. This slide shows the left side is voiding contraction times. The right side is reduced EMG activity times. So reduced EMG activity time was significantly increased after PD5 treatment. So this means improvement of DSD. This slide shows real-time PCR result. The expression of TRPV1 messenger RNA in DRG and muscle increase in SCI mice compared to spinal intact mice, and significantly decreased after PD5 inhibitor treatment. So this slide shows TNF alpha messenger RNA. So after spinal cord injury, TNF alpha in urethral mucosa and muscle significantly increased. And after PD5 treatment, significantly decreased. So PD9 inhibitor treatment improved detrusor overactivity, evidenced as a decrease in non-voiding contractions in association with the reduction of expression of TRPV1 in DRG, which are predominantly expressed in C-fiber afferent pathways. PD9 inhibitor treatment also improved the voiding dysfunction as shown by decreased post-void residual due to the increased relaxation period of EUS EMG activity in SCI mice. PD9 inhibitor treatment was also effective to reduce inflammatory molecules such as TNF alpha in urethral bladder mucosa and muscle, and sensory molecules such as TRPV1 in DRG, which may be involved in SCI-induced afferent hyperexcitability and voiding storage dysfunction. In conclusion, PD9 could be an effective target for treatment of storage, voiding, or urinary tract dysfunction after spinal cord injury. Thank you for your attention.
This paper is open for discussion.
Yeah, Tony Kanine from University of Pittsburgh. That's a very nice talk. So have you looked at the effects or tried to compare this with PDE5 inhibitors? And then the other question is, what's the regional distribution of PDE9?
The second one is PD9. Thank you for your question. PD9 is expressed, it has been reported brain, skeletal muscle, urinary tract, and corpus cavernosum. So recently, PD9 is have much attention for potential therapeutic for Alzheimer's disease. So we, in this study, we check the urinary tract, the PD9.
So in the spinal cord, these were transected animals, right?
Yes.
So you think it's still working through the CNS?
Yes. We didn't check the CNS this time, just the urinary tract.
Did I miss something, or did you forget telling us which PDE9 inhibitor you have tested? I didn't see it on the slides.
That's correct. It isn't mentioned here.
It's not in the abstract. Yeah.
Well, is it a secret? Do we have to believe? I mean, I'm happy to believe in God, but I don't believe in data I haven't seen.
Which inhibitor did you use?
Which is the compound?
What is the compound?
Compound.
Yes, which inhibitor, which PDE9 inhibitor
PDE9.
did you use?
PD9 inhibitor. I forgot, sorry. MSD company, yes.
Well, more
Any
questions?
of the other authors in the audience know the compound name? Okay. It is also being studied for schizophrenia, right? Like it has a lot of central effects.
Yes.
Some of the inhibitors, right?
Well, I have a question. What could be the difference between this inhibitor and the PD5 inhibitor? I mean,
Can you answer that question?
we have heard now that low concentrations of sildenafil increases the activity that you find is inhibited. Well, why don't we suggest that you test your inhibitor in the model where you tested sildenafil? Well, yeah, I direct that to the co-author, for example, Tony Kanai or Chris Fry.
Can I answer that question?
Yep.
Okay, so we did some study for sildenafil for the SCI rats, and we didn't see much in avoiding this improvement, avoiding dysfunction. It's actually reduced the overactivity of the bladder. So probably this effect we haven't compared side by side, but probably in terms of improvement of bladder overactivity, probably PD5, PD9 inhibitors are similar. But in terms of that improvement, avoiding dysfunction, probably reduction of DSD, probably PD9 is better. We don't decide where the action place of action, but probably in the spinal cord. Under the injury level, they improve that voiding reflex. Improvement of voiding reflex can reduce that DSD to improve that voiding dysfunction, which is probably is not seen much in the PD5 inhibitors.
Okay.
Oh, just to answer your question, Karek, those studies are planned and they will be ongoing shortly to compare with PD5.
Hmm?
Definitely we can do for the comparison with the PD5 inhibitors.
No more questions? Thank you very much.
Thank you very much.